Good morning, everybody, and happy Thursday. Today is April 22nd, 2021. Thanks for everyone for joining our Facebook Live today. We're going to talk about some current events that are going on in our industry and kind of what your plans are for continuing to operate your program. So welcome everyone that's hopping on. For those of you that this is your first time doing a webinar with us, I'll go ahead and tell you a little bit about how this goes. We're going to have our live webinar where you are able to participate and ask questions and make comments on the chat screen on Facebook. Because this is live and you have the opportunity to interact with me, it makes it instructor-led with childcare licensing. So that'll help you get those instructor-led hours, the 20% of your training that you are required to get. At the end of today's workshop, I will post a link for you to complete an online worksheet. You can submit that online worksheet to me if you are needing a certificate of completion. There is a $5 fee for the certificate of completion, and that's how we take attendance here. So there's no need to type in your name, or there's no need to tell me that you're here unless you just want to say hi. But you'll do your online worksheet at the end of the workshop today. So that's kind of how it works right there. If you're just wanting to listen and participate and watch the webinar, it's free. You don't have to pay anything. So it's just $5 if you're needing a certificate. So that's kind of how it works. It's been a really busy month and we haven't had a Tim at 10 in several weeks. So I kind of feel out of place all of a sudden, like, what are we doing? First off, look at these numbers. Look at the number of people that are joining us this morning. This is fantastic. Thank you all so much for being here. First off, I just want everyone to take a deep breath and give yourselves a huge pat on the back. I know that times are tough right now. They've been tough for the past year. But right now, it is a really difficult time, and a lot of you are working very understaffed. A lot of people are having staffing issues, and you're tired. I totally get it, totally understand. So, just hang in there. It's going to get better. We're actually doing a director workshop tomorrow on building a successful team, and we're going to spend a great amount of time talking about the staffing issues that we're having right now and some possible solutions to it. Unfortunately, I don't have a magic wand and I don't know the magical answer to the staffing needs out there. I've probably gotten 50 phone calls and emails and messages from people asking me about, how do we get staff? Well, I don't know. But we're going to talk about that tomorrow, and I do have some things to share with you. Today, we're going to talk about a couple of different things. I want to talk about the executive orders, or the emergency orders, I apologize. The emergency orders that expired earlier this week. We're going to talk about that. We're going to talk about your plans for continuing to operate your program and the possible risk that you may open yourself up to, but also how to protect yourself from that risk. We'll talk about that. I also want to talk a little bit about the $4 billion in stimulus money that has been given to the childcare industry. We'll talk a little bit about that right there. And then I've got a very brief legislative update to give y'all on some possible legislation that is happening down in Austin. Things are really starting to happen down there. It's that time of the year. And so I'll kind of fill you in on just a handful of bills that you probably need to be aware of. So that's kind of what I've got on our very short amount of time that we have together this morning. All right. So first off, difficult conversation time, okay? There's a lot of things that are going on that are very concerning to me. I'm very, very worried about some of the communication that's taking place out on social media. And I know that we're on social media right now as we speak, so it's a little hypocritical, but you know, I see a lot of these different Facebook pages and a lot of different posts and people giving advice and people talking about what their plans are for continuing operation, and I'm cringing because there's a lot of wrong information that's being shared. There's a lot of really bad advice that's being given to programs and some very illegal advice that's being given on lots of different social media pages. So, you know, I really want to throw that out there because, you know, as we're seeking guidance on how to continue our operation, definitely we want to network, we want to share with each other, but it's so important that you always consider your source and you really look at who's giving advice and do they have the right information, all right? And I keep seeing a lot of comments that are being shared on these different Facebook pages. And then I've even received a lot of phone calls and a lot of messages and a lot of emails from people saying, oh, well, their local licensing rep told them this, or another center in the area told them that. And there's a lot of interpretation issues that are going on. And definitely, you know, I'm just going to share one thing with you, if this is okay. I had a phone call earlier this week from someone telling me that their local licensing rep had told them basically that they could not continue to accept children at the front door and escort children back and forth to the classroom, that they had to allow parents back into the building or they were going to be cited and closed down. And, you know, we're going to talk about that and I'm going to address that right there. And I said, well, that's not exactly true. All right. I think your local licensing rep gave you some bad advice and some misguidance. Well, after about 10 minutes of conversation, it ultimately came out that that's not what the local licensing rep said. All right. So, you know, once we kind of got down to the meat and the bones, people hear what they want to hear sometimes. And people have their own interpretation or their own version of reality on the advice that's being given. And in this particular situation, after about 10 minutes of phone call, you know, it came out that that's not what the local licensing rep said. That's what this particular director heard. All right. So we're going to kind of talk about facts here. We're going to talk about direction. And I just really want to make sure that we're all, you know, heading down the right path, because this is a very slippery slope for us. And though it may be exciting for some that the emergency orders have expired and we can go back to normal operation, it's also very scary, you know, for some people too. It's exciting and scary at the same time. We don't want to go backwards, okay? We don't want to make mistakes and allow exposure that's going to put us back into another emergency order that could possibly disrupt our business even more than it has over the past year. Okay, so we've got to make good, solid decisions, all right, that is backed up with facts, all right? And that's what, again, I really, really want to talk about today, you know, moving forward on that right there. All right, so any of you that have taken my 4-day director credential course, y'all have heard me say this 1,000 times. There's certain chapters of the child care minimum standards that, you know, I will always ask you, do you want to make this super difficult or do you want to make this super easy? You know, the choice is yours. Sometimes we make things harder than they should be. All right, when in reality, this is pretty easy. All right, so don't make it more difficult than what it already is. When we talk about parents' right to access, all right, in the state of Texas, a parent always has a right to access their child. Even during the pandemic and even during the emergency orders that were issued by the Texas Department of Health and Human Services, parents have always had a right to access their child. If y'all go back to the emergency orders, it has said since day one that, parents are to drop off and pick up at the front door. However, they can enter the building when needed. That's been in the emergency order since day one. It's no different right now, all right? And I was talking to someone earlier this week and trying to get them to understand the situation that we're in right now. And, I was kind of like, it's like prior to the pandemic. So before the pandemic even started, there were thousands of programs that did carpool lines. And some of you might have been one of the programs that did a carpool line. And, children were dropped off and picked up in the carpool line. It's no different. It's no different than that carpool line that we've been doing for 20, 30 years, all right? That is your policy. Those are your processes that children are dropped off and picked up in the carpool line, but the parent always has a right to enter the building anytime they feel needed, all right? Just as a convenience factor, you've done a carpool line. Now, it's no different, okay? So, many of you may choose to continue the process of parents dropping off and picking up at the front door. You just don't feel like you're ready to have them back in the building. That's okay. You can continue to do that. You just need to make sure that it's in writing that they still have a right to access their child. They still have a right to enter the building when needed. As long as you have that laid out there, you're going to be just fine no matter what decision you make. All right? I want to refer you to the Child Care Minimum Standard 746-201. All right? And it's on page 9 of the current copy that we have out there. All right? First off, number 1 on 746-201 says that you develop and implement your child care center's operating policies which must comply with or exceed the minimum standards. And the key word that I want y'all to focus on right here is the word exceed. You always have a right to go above and beyond, especially when it comes to the health and safety of the children. So if you choose to write that policy or process or health protocol is kind of what we're calling it, that parents are still encouraged to drop off and pick up at the front door, that would be in the category of exceeding. All right. However, I also want to point to number 7 on this same page. So 746-201, number 7, it says that you ensure that parents have the opportunity to visit the child care program at any time during the operating hours to observe their child, program activities, the building, the grounds, and the equipment without having prior approval. All right. So fine. All right. No big deal right there. No big deal. So, you just want to create a health protocol, and I would recommend that you put it in writing. Y'all know my golden rule on documentation. If it's not written down, it didn't happen. All right. And you're going to say that we're going to encourage parents to continue to drop off and pick up at the front door. However, they may always visit the building to observe their child or the program at any time without permission. You're just going to basically cut and paste number 7 into your health protocol, if that's what you choose to do. All right. I do have 2 different versions of a document that I'm working on. I just threw it in my bag over there too. That I will definitely share with everyone once I get it done. I actually worked on it almost all afternoon yesterday, and I kept playing around with different wording. One, if you choose to allow parents back into the program. Another document if you choose to continue to follow the health protocols that we've been following. So I think it was Christy that just asked that question. Of course, I'll be more than willing to share that with y'all. Once you decide what you're going to do in your program. All right. So, and that would include, Stephanie's asking here about authorized pickups, guardians right there, where if they are grandmas, I'm sorry, my eyes are getting really bad, y'all. Basically, number 7 on 201 says parents, so the biological parents or whoever has legal custody of that child has a right to access the program. To observe their child, the building, the grounds, etc. That would only pertain to, like I said, the biological parent or whoever has guardianship of that child. If it's an authorized pickup, you can limit them. All right. So kind of to answer that question right there. All right. So I feel like, again, a broken record about, so many things that we've talked about over the last year, and we keep kind of saying the same thing over and over and over again, except it seems like there's just different layers that keep getting added onto it. I was actually watching a webinar yesterday with my good friend Don Martini with Ron McGuckin's office, and I have to agree with Don 1,000%. I cannot wait until we never say the word COVID again, or when we have the conversation, remember when, I just can't wait for that day, right there. So, but we always need to think about, and this is something else that any of y'all that have taken my 4-day class, or even several of our webinars, I've mentioned this. When you're making a decision in your program, you always want to ask yourself, how would this decision be perceived by a jury? Okay, so whatever decision you're about to make, how would this decision be perceived by a jury of my peers, all right? Because if you end up in a lawsuit or someone presses charges against you and it does go to trial, your fate is in the hands of a jury, okay? So sometimes, yes, you want to be concerned about licensing. Yes, you want to be concerned about the health department, all of these regulatory agencies. But a jury of your peers is neither of those things. And your fate may be decided by this group of people, all right? So when you're making a decision on how you want to move forward with the operation of your program, make decisions that would be perceived by a jury in a positive way, that you are doing whatever it takes to protect the children in care and the employees that are working for you, all right? That we are still going to continue practices and protocols to protect those individuals. And once again, you want to make sure that all of this is documented, all right? That you have documentation showing that you are going above and beyond to protect the children in care and the employees that work for you. And you want to make sure you've got good documentation that you're not intentionally placing people in harm's way, all right? So I want y'all to think about that whenever you're making these decisions on how you're going to move forward. Am I putting anyone in harm's way? Am I intentionally putting anyone in harm's way? And am I placing my employees and my children at risk? All right? So there you go. I can't tell you, what decision to make, when it comes to parents' access to your building, whether you're going to let them back in, whether you're going to continue to drop off and pick up at the door. There's pros and cons to both. I think all of us would agree, we've talked about this in multiple webinars, a lot of us would agree that our illness exclusion has gone to an all-time low over the past year, that we're not sending children home sick as much as, we used to. And there's a lot of different factors that are contributing to that. Our enhanced health practices, our enhanced exclusion policy, of course, the parents not coming in and out of the building because they're not regulated with health protocol. And it's been nice. It's been really nice that our illness exclusion has gone down, all right? We want to take that into consideration. Allowing parents back into the building, we may start having those illnesses again, all right? it's going to be very interesting to see what happens over the next 30 days. If we start letting parents back into the building, all right, are we going to start seeing an increase in COVID cases? Are we going to start seeing an increase in other illnesses? Personally, we are leaning towards sticking with our current practices, encouraging parents to drop off and pick up at the front door, of course, allowing access if needed. But I kind of want to see what's going to happen to everybody else over the next 30 days. Not that I want to use all of y'all as a guinea pig, but I'm very curious to see how this is going to go. All right. And so that might be something to take into consideration, because I know for a fact there are some programs that are already allowing parents back into the building. I know for a fact that there were some programs that were allowing parents into the building before the emergency orders even expired. All right. So those people that were violating that emergency order, you have to wonder what else they've been violating, is what my take is on that all the time. So to kind of answer your question, Mandy, right there, we're probably going to just stick with what we've been doing for the last year. All right. We're probably not going to make any changes at this point in time, because I just want to sit on this for about 30 days and kind of see what happens. Is kind of my take on it right there. All right. So, the game plan that I have drafted up for those of you that are considering letting parents back into the building, the discussion that we've had is to allow parents to come in. They have to wear a mask, is what we have talked about. They will still be screened, so we're going to continue to screen children. We're going to continue to screen the adults dropping off and picking up the child, because if the adult dropping off and picking up has symptoms, then the child's been exposed. All right, so we're going to continue to do that. What we talked about is that if we allow parents back into the building, that parents are dropping off and picking up their children at the classroom door. All right, so they're not actually entering the classroom. The problem that we've kind of ran into with that discussion, because this is just a discussion at this point, is about the playground. And when the kids are out on the playground, how is that going to work? And so depending on your building and the way your building is designed, you might have some obstacles with that right there. All right. I'm just reading some of the comments. Some of y'all write really long comments and I can't see all of them. If a parent knows all the policies and procedures, whatever they may be, and they're signing it with it. Well, okay, I'm going to address that here in just a little bit, because parents don't always follow your policies and procedures, and they're not always honest with you, but that's actually in my agenda that I'm going to talk about right there. Parents are dropping off and picking up at the classroom. Parents are going to be wearing a mask. And then I saw a question earlier about limiting the time in the building. That is definitely a recommendation that I have, is that when normal drop off and pick up, we limit the amount of time that the parent's in the building. So we encourage parents to avoid lingering or congregating in the building, and definitely they need to be following physical distancing and staying 6 feet away when possible. All right, so that's the recommendation right there. Now again, if they want to observe their child, they want to observe the program, they have every legal right to do that. But for a normal drop-off pickup procedure, yes, I encourage you to draft something that says it needs to be a limited amount of time. You're in and you're out, all right? So we're going to avoid lingering or congregating in the building. I think that's a very smart protocol to adopt right there. All right, like I said, definitely still screening. I personally, would encourage all of y'all to continue to screen both the adult and the child, like we've already mentioned right there. And another protocol that we should have been following this entire year that I think has been ignored, and I strongly encourage all of you to put this in writing and send it out to your parents once again, that the entire family is excluded from your program if they have symptoms related to COVID, or if they are waiting for the results of a COVID test. And that last part is where so many programs are getting burned, all right? And I keep hearing this story over and over and over again, where, you know, the kid has been in attendance Monday, Tuesday, Wednesday, and then Thursday, mom comes in and goes, oh yeah, dad tested positive. Well, when did he get tested? Well, he got tested Monday afternoon. We just got the results last night. Well, if dad got tested Monday afternoon, why was the child in care Monday, Tuesday, and Wednesday? That entire family should have been excluded from your program while dad was waiting for the results of the test. Now he's positive. The child has been exposed. They've been at your program for 3 days. You got a big risk right there. And so, you know, that being excluded while waiting for a test result, a lot of people are ignoring. And so kind of going back to the comment a little bit ago about if a parent knows your policies and procedures and they sign off that they're going to follow your policies and procedures, you know, should you be okay? In a reality, in a perfect world, yes. All right, in a perfect world, yes. But y'all know as well as I do that our people aren't following our policies. And I'm not just talking about parents, I'm talking about employees too. And that's why, you know, the document that I was working on yesterday afternoon, that once again, I don't mind sharing on my website once it's done, is that we still need parents to make decisions that are in the best interest of everyone, and make sure that parents understand that the decisions that they make at home affect your entire program. And if they're making a decision that places their child at risk of exposure, and then they send their child to our program, they're placing every single child and every single employee at risk. We need them to continue to understand this, even if they've been vaccinated. All right? Because you got to remember, the child is not vaccinated, the adult is. So there's still a big risk right here. And I want to back up on that because, you know, this has been another big argument that I keep seeing out there in social media and then just in the community, that, you know, yes, our emergency orders have been lifted, as well as the mask mandate and all of these different things. And so businesses are now allowed to make their policies and enforce their policies as applicable for their business. But, you know, we kind of live in a state where our governor wants, you know, individuals to take responsibility for themselves. And if you feel safe going out and doing whatever, or going to a place, that's your choice, and you're going to take that risk on yourself. Or if you don't feel like this is a safe environment, then don't go. All right? And I do get it. I understand it. I mostly agree with it, that we're at the point in the pandemic where people have to start taking responsibility for themselves, and you've got to start making decisions that's in you and your family's best interest. Get it. I totally get it. However, the children that we care for can't make that decision. They are too young to make that decision, so they have adults making these decisions for them. And then that adult is sending the child to our programs, all right? That's the part I've got a little bit of some issues with, is that we still have a big risk right there, okay? Also, I just want to remind everyone, because we started this conversation with talking about risk of lawsuit and risk of liability, and you still have an obligation to prove that you're going above and beyond to protect your children and to protect your staff, and that you're not putting anyone in harm's way. Of course, the email that we got from Health and Human Services, you know, stating that the emergency orders were not going to be extended, did recommend that we continue to follow CDC guidelines, all right? The CDC guidelines for child care centers. So as much as you can still follow those CDC guidelines, as much as you can still follow the protocol, the health protocols from the governor's office, the better off you're going to be, All right, now it's not a requirement, but it is a recommendation. But again, if you end up with a claim or a lawsuit, it's going to be really important that you prove that you did everything in your power to protect your people. So I would definitely document as much as possible that you're still following the CDC guidelines for child care centers. Now, again, we had a webinar on this about 3 weeks ago. Some of the stuff that's in that are just not reasonable, but I'm just going to be blunt and throw it out there. We all know that some of the things that are in there are just not, it's not going to happen, all right? But you're going to try the best you can with what you've got, all right? The best you can with what you've got. Okay, so, hopefully that was some helpful information and definitely kind of got you to start thinking like you're a jury member, and you're going to decide what's in the best interest of your program. And it's going to be different for everyone around the state. You're going to look at the number of COVID cases that are happening in your community, and you're probably going to, decide, your health protocols moving forward based on the number of COVID cases in your community. And for some areas, it's not happening very much anymore. Some areas still have some hot spots, all right? So, it's going to be different. And definitely I would document, make sure that this is documented in whatever communication that you send out to your parents, that your health protocols are contingent on the state of the pandemic. And if we see a rise in cases or an increased number of illnesses that are coming into the program, you may go backwards, all right? And you may go back to, whatever protocol you feel is best in that situation, okay? This question about our center is going to be able to require to quarantine children if someone tests positive. So I'm going to refer to the CDC guidelines on this one. That's a really good question. I actually didn't have that in my agenda, and I should have. We need to talk about that. So of course, y'all know that the CDC has come out and said that if you have an adult that has been vaccinated, or if you have an adult that has successfully recovered from COVID over the last 90 days and they are exposed, they're no longer required to quarantine. So that's important. That's really important right there. The other thing that layers on top of this is that with the Family First Coronavirus Act, the FFCRA, that changed on April 1st as well. That employers are no longer required to pay their employees for time off for situations related to COVID. It's now optional. You can still get the tax credit if you do pay your employees for their time off for the COVID-related instances, and there's 4 categories now. And you can still get that tax credit. However, if you have received PPP money, then no tax credit for you. You can't double dip into the 2 different programs. So that's kind of major, especially since many of us are way past spending our PPP money. Our PPP money is gone. There's nothing left of it. But if you did receive PPP, then you can't get that tax credit. And there's some gray areas to that whole language, and I don't want to go down that rabbit hole right now. But kind of letting your employees know that over the past 9 months, people have been getting paid when they've been forced to quarantine. But as of April 1st, you either have to use your paid time off that you've earned or accrued, or it's unpaid. So it might be a good incentive for you to get vaccinated, so that way you don't have to quarantine if you've been exposed. All right? So, a lot of people have been asking the question, can I require my employees to get vaccinated? You can make it a requirement for your employees to get vaccinated. You still need to consider that there are some protected classes. So if you have an employee that cannot get vaccinated due to medical reasons, due to religious reasons, due to their beliefs and convictions that they are currently practicing, All of those factors have to be allowed, just like any other vaccination. But yeah, you could. It's a slippery slope, and I don't recommend it, but you could. Now, the biggest thing about the vaccination that I've been telling people about is we've been required since 2011. We've been required to have our vaccine preventable disease policy. All right, so 10 years we've had this vaccine preventable disease policy that's been required by licensing. The COVID vaccine is no different. Again, let's make this easy, okay? You're just going to add the COVID vaccine to your already published vaccine preventable disease policy, all right? And however you choose to do that. I recommend that you make the COVID vaccine a recommendation, all right, and not a requirement, because again, you get into some really slippery issues with protected classes right there. Now, a lot of people are, can you offer an incentive for your employees to get vaccinated? Sure, that's completely legal, and as long as it's done in a fair way, absolutely. So we're actually offering our employees a $150 incentive once they are fully vaccinated. And fully vaccinated is 2 weeks after they've received their second shot, or the JJ is kind of on hold right now, but if they got the Johnson & Johnson, then 2 weeks after they received that one. But we are offering a $150 incentive for those that get that vaccination, because that's going to help me keep staff in my building. We're going to talk about that tomorrow, okay, in our director's workshop right there. Can you ask for documentation that they have been vaccinated? Absolutely. People keep bringing up HIPAA law. Well, we're not health insurance, okay? We're not a doctor's office. We're not a hospital. So HIPAA doesn't really apply to us. So, those of you that want to throw out the HIPAA word, we're in the wrong business for that, all right? Now, the Privacy Act, different story. You're just going to keep that documentation confidential, just like any other medical documentation that you've got on your program. All right. Just kind of reading some of these comments right there. Yeah, definitely. I would never recommend that you buckle a child into a car seat. The parent needs to be the one doing that. If you have your staff putting children in car seats and buckling them in, ooh, that's a huge liability. Your insurance company is going to slap you around for that. All right. Definitely, I would mention the COVID vaccine in your vaccination policy if that's what you choose to do. You want to be specific about that right there. All right. You know what? We actually talked about this yesterday afternoon as well. I think it would be interesting to survey your parents and ask them how many of your families have received the vaccination. That may help you make your decision on whether or not to allow parents back in the building or continue to drop off and pick up at the front door. Kind of getting a percentage of how many of your moms and dads and guardians have been vaccinated. I think that's really smart right there. Now, again, you got to be really careful with asking that question. You can't force them to answer it, but if they're wanting to volunteer whether or not they've been vaccinated, I think that's valuable information for you to have. All right. Just like in a job interview, we talked about this yesterday too, and we'll talk about this more tomorrow with building a successful team. But, is it legal to ask an applicant, have they received a vaccination? I would stay away from that question, all right? Because if you don't hire them, they could come back and sue you for discriminating against them for not being vaccinated, and especially if the reason why they haven't been vaccinated falls into a protected class. Like I mentioned, medical reasons, pregnancy, beliefs and convictions, religion, that could be some dangerous stuff right there. All right. You can ask on medical documentation, you can ask them for a copy of their vaccine card or to show you that your vaccine card, just keep it confidential, folks. COVID test, whether someone is positive or negative, definitely you have a right to ask for that information. Once again, you'll just keep it confidential if that comes up. All right. Very good. Holy cow, it's 10:40 already. Like I said, staffing, I know that all of us are really struggling with staff right now, so if y'all want to tune in tomorrow, we're going to be talking a lot about staffing tomorrow, so tune in for that. All right. Questions have come up about ancillary programs, and is it okay to allow ancillary programs back into your program? Technically, yes, since the emergency orders have been lifted. Once again, how would this be perceived by a jury? That you have an ancillary program that is visiting multiple centers and interacting with multiple groups of children on a daily basis, and then you're allowing them into your program to interact with your kids, knowing that they have been in several other buildings with several other groups, and you're allowing these people in, and heaven forbid someone get exposed and someone test positive, and especially worst case scenario, they die from it. All right. It's not going to look good. It's not going to go well for you. All right. So technically, can you allow ancillary programs back into your building at this point? Yeah. Is it a good idea? I don't think so. All right. And I got a lot of friends that's their business, is ancillary programs. And I send you well wishes, and I know it's tough for you right now. I just don't think we're there yet. All right, so we've got to be very, very careful. Field trips during summer programs. Technically, yes, you can go on field trips as long as you're following the health protocols in your community. Again, I think you're taking a huge risk if you're scheduling field trips. We kind of worked on a summer calendar here at my schools, just in case the world gets better and we have some magic happen, then we've got some things planned. We couldn't find anyone that would take us. So, the decision was kind of made for us that we're not going to do any field trips this summer. Mainly because I don't think we're ready, but then also we couldn't even find places that would take us. Even some of the public parks have limitations on the number of people that can be at the park at one time. So, again, I'm going to go back to what I've already said multiple times today. If you're wanting to do field trips this summer, how would it be perceived by a jury that you're knowingly taking this risk? All right? There you go. All right? Bree, that's a little off topic about ancillary programs needing background checks, but I'm going to refer you to the minimum standards when it talks about do they have direct access to children, and are they going to be in your program on a regular or frequent basis, which is defined as more than 2 times in a 30-day period. All right, so those are the factors that you've got to look at on whether or not a background check is due. All right. Let's talk really quick because I keep getting this question over and over again. The $39 billion, I think I said 4 earlier, I was way off, wasn't I? $39 billion that has been earmarked for licensed child care facilities as part of the new stimulus package that was signed into law a few weeks ago, all right? So the $39 billion is broken up into 2 different categories. There is $24 billion is being earmarked for child care stabilization. And that's going to be given to programs to assist with rent, mortgage payments, personal protection equipment, money to rehire workers. And something that I thought was very interesting, the money can be used for mental health for your employees. So if you're needing to hire someone to come in to support mental health, all right? So $24 billion is earmarked for stabilization. $15 billion is being earmarked for flexible funding, which is basically the subsidy system, All right, now this is good news. This is very good news, especially for those of you that participate in the subsidy system here in Texas. All right, so a total of $39 billion. Texas, I'm sure you've heard this on the news, maybe. Texas is getting the largest amount of money. All right, so we are getting basically $1.6 million for the flexibility funding and 2.7 for the stabilization. Okay, and so that's kind of how much Texas is going to be getting right there. We don't know at this point how Texas Workforce Commission is going to distribute these funds or what the eligibility is going to be yet. So I've gotten a lot of people that have been emailing and calling me asking, how do I get my hands on some of this money? We don't know yet. All right, so we need to put a pause on that question because we just don't have the answer yet. Okay, so Christy just asked it. We don't have the answer to that question yet. There is a meeting this week. Texas Workforce Commission is meeting this week to discuss how they're going to distribute these funds. Now, the subsidy money, is basically going to probably be done the same way it was done the last two times. It was given to Texas Workforce Commission, and those of you that participate in subsidized programs, we've been getting the extra 25%, since last summer. That's been wonderful. That's been nice, all right? We need to count our blessings and show some gratitude for that extra money that we've been receiving. Now, of course, y'all know that they are slowly tapering that down and weaning us off, and by the end of July, that money is supposed to be gone, but they're doing it in layers. I'm hoping that, this 2.7 that's being given to Texas Workforce Commission, I'm hoping that they're going to continue that 25% and stretch that out even longer for those of us that take subsidized children. All right. Now, the good thing about this, and the biggest complaint that I've heard, and I have to agree with this, is that if you don't take subsidized children, then y'all have been left in the dark and you haven't been getting much support at all. So with the way that they have it divided up between the stabilization and the flexibility, I think that those of you that don't take subsidized children, your time is coming, all right? That there might be opportunities for you to get some assistance with the way this is broken down. As soon as we have more information, I will share it with you. I'm watching it, I'm keeping up with it. And so that is a stay tuned, all right? But what we do know is, the $39 billion, how it's divided up. We know how much Texas is getting, and so that's encouraging. All right, so stay tuned on that. Hang on, let me. Yeah, well, and here's the thing about, you hope that they will do it in a way that is fair to all programs. What's the definition of fair? That comes down to each individual person's interpretation. Some people may think that it's being distributed fairly now. Some people may not. So I understand and I hear what you're saying, and so yeah, I have to agree with you, but that's a tough one because what is fair and what is not fair? I don't know. All right, let's talk really quickly about some of our activity down in Austin and what's going on. I only have a handful of pieces of legislation that I just want to make y'all aware of. There's not as much going on as we normally have in our area. Where's my other page of, hang on, I lost something. It's okay. Oh well, it's not important. All right, so the important thing is that our legislative session is going on right now. It's going to go on until the end of May, so we have a little bit more than a month until our legislators conclude their session. The deadline to file bills have passed, all right? So what's been filed we know about, and there's not going to be anything else. All right, so the deadline has passed at this point. There were several pieces of legislation that we were expecting this year that have not been filed. So there's some surprises right there. We were expecting something on ratios. We were expecting something on group sizes, and it didn't happen, all right? Unless you got a crafty lawmaker that's going to try to throw it into a committee report somewhere, we dodged those bullets this time around. All right. First off, we've got House Bill 1792 that has been passed in the House and is now over in the Senate. This one is in regards to Texas Rising Star and the way they do their assessments. There's really nothing to talk about on this one at this point. All right. So, but that one has passed the House and it's on to the Senate. There you go. We'll once we know more about that one, we'll share it. But it doesn't appear to be too devastating unless you are participating in Texas Rising Star. There's just going to be some more accountability. All right. Here's a big one. All right, and it's House Bill 2607. This one has passed in the House and is now over in the Senate. Y'all, I hate to be that person to say I told you so, but I've been telling y'all for 15 years now that this was coming, all right? Texas is one of the only states, there's only a handful of states out there that don't have some type of required quality rating system outside of licensing that programs must participate in. And Texas Rising Star, which is a quality rating system, is optional, all right? So you're not required to participate in Texas Rising Star. Well, House Bill 2607, all right, will now require anyone that is accepting subsidized children to participate in Texas Rising Star. So it will no longer be an option, it will be a requirement if you are accepting subsidy children. All right, and it will be in a phased approach. It's going to be a phased in approach, but that's what 2607 is all about. Now, those of you that are already Texas Rising Star, no big deal. We're already there, all right? If you're not doing TRS, this might have a big impact on your program right there. Another very exciting piece of legislation that we're watching very closely is House Bill 619. And this is, once again, it was passed in the House of Representatives on April 20th and is now over in the Senate. This one will require the state to come up with a plan that will support licensed child care facilities and our turnover rate, and to help us with reducing our turnover rate and increasing our salaries for our teachers. Now, how they're going to do this, we don't know yet. The bill calls for a plan on how to reduce turnover and increase wages. It also talks, and I actually have this piece of legislation printed out right here, it also talks about a plan that the state will develop a plan on professional development and supporting centers and getting quality professional development and the state paying for it, all right? So that's what House Bill 619 is all about. Could be a really good bill for us, all right? It could be a really good bill for us, and we'll kind of see how that moves along right there, all right? So really, honestly, that's it. When it comes to a legislative update, there's about, I think I counted 32 pieces of legislation that pertain to child care. Nothing else is really earth-shattering. Those are the biggest ones that I wanted to pass along to y'all and tell y'all about right there. All right? And we'll continue to track those. I'll continue to keep y'all updated, and especially if someone tries to throw in a surprise, then we'll throw that out there. All right, so we're kind of at the end of our webinar right now. Those of you that kind of came in late, I'm glad that you were able to make it. You were probably covering a classroom or cooking because we're short-staffed and that's what everyone is doing. But if you joined in late, remember that you can go back and watch the entire webinar on Facebook. I will also have this posted on my website later today. All right. Anyone that missed today's webinar that wants to watch it, once again, it will be available on Facebook and also available on my website. All of our videos are available right there. Reminder that I have a director workshop tomorrow from 9 to 12. We're going to talk about building a successful team. We're going to really address our staffing shortage right now and how to support our programs with staffing and coaching and getting people to stay with us is really what tomorrow is all about. And then on Saturday, I'm doing something a little out of the box on Saturday. We have a teacher workshop on Saturday from 9 to 12, also here on Facebook. And I'm going to cover the 6 required trainings that are required by the child care licensing, the hazardous materials, food allergies, emergency preparedness, immunizations, all of those 6 required topics that we have to do every year. We're going to do it all at one time on Saturday morning from 9 to 12. So check that out if you're available. If you can't catch it Saturday, once again, it will be recorded, so it'll be available for your staff after the fact as well. Your online worksheet for today should be on Facebook right now. So if you refresh your browser, it should be the first thing on the wall. You can click on the applicable link to complete your worksheet for those of you that are needing a certificate of completion for today. If you're going to pay with a credit card, click on online worksheet paying with credit card. If you have set up an online account with me, then you're going to click on the link for online account holders. If you don't know what I'm talking about and you don't know if you have an account with me, then I'm going to assume you don't. So make sure you click on pay with credit card. All right. If you want to set up an account, just go to our website and the instructions are on there. As always, feel free to give us a call, shoot me an email. If you have any questions or need some guidance or coaching, we are always here for you. Facebook Messenger, I have a love-hate relationship with Facebook Messenger, so I prefer a phone call or an email, but I will try to answer your Facebook message, assuming I get it, all right? But like I said, we have a love-hate relationship right there. All right, hang in there, everybody. Hang in there. I know it's tough right now. There's a lot of things going on. It's a very uncertain time. It's kind of like, we've prayed for this moment to come when we can return to normalcy. And now that the moment has come, we don't know what to do with it. And it's tough. It's very, very tough. And you're going to have to come up with the correct answer for your particular program. And it's going to be different. All right, across the board. All right, enjoy the rest of your Thursday. I hopefully will see lots of you tomorrow and Saturday. I miss all of you. I cannot wait to be back in person with you someday. Hopefully that time is coming soon. But until then, we will continue to do Facebook Live events and everything. And so we'll just make the best of it. All right, bye everybody.